So thank you very much for inviting me. Access Alliance is we're a community health center. We're focused on working with most vulnerable populations in Toronto. Our historical focus has been immigrant and refugee health, but this has evolved over the years, in large part due to our engagement in community-based research. So our understanding as an organization is that the impact of systemic barriers, which we do address, is multi-generational in impact. So we do have to look at generations in communities. So moving away from that immigrant and newcomer definition, and also our understanding of the impact of the racialization of poverty. So as a community health center, we made a decision many years ago to develop a community-based research program. So, in consultation with funders and, with the support of our boards of directors and, with a little bit of magic, have developed this capacity. This is our vision. As you can see, we are systems change focused. Again, as I said, the systemic barriers, individual services and community level services is very important, but we have to look at changing that system. As a community health center, we are committed to evidence-informed decision-making and practice. So this suggests that we're guided by the best research and information available. And again, as an organization, many years ago when we started thinking about this in a drill-down way, that's when we started that's when we started developing our approach to community-based research and our commitment to co-creation of knowledge with communities. Because from our perspective, from the perspective of our vision and mission, evidence is meaningless if it is not linked to systemic change, so a commitment to systemic change. So that's our organization. We have a research department embedded in our community health center. I'm not the researcher, I'm the executive director, so I'm part of development of the strategic direction, but we do have a senior researcher on staff who was an academic and came over to the other side. So I'm going to talk about some of our experiences and things that we've learned. So most of them are self-evident. I think Diane, we asked, United Way got feedback from participants, what would they like to think about? And Diane talked about, we state the obvious, and I thought, yeah, that's so self-evident. We do state the obvious, and so what? Research has no value if it's not actionable from our perspective. While we have excellent experience working with amazing academic partners, many researchers have very little interest with the uptake of their research. And so this is often linked to how then research is carried out. The kind of institutional structure and framework drives how the research is carried out. Evidence, and our experience is that evidence is valued so unequally and hierarchically. Randomized control trial studies and systematic reviews are on top, and qualitative and community or gray literature on the bottom. And we do need to undo this hierarchical view. Each type of research, method, and evidence has its own unique value, only captures a piece of the story, and it's only in combination that they can give us a more complete picture of our very complex and messy reality. So I told you Gendra I would name him because he helps me do all my thinking. But I sent him a question by text about something, and he sent me back this answer. Well, wasn't an answer, it was just a thought. So, and it's completely on point, so I want to read it. This is Yogendra Shakya, our senior research scientist. Undoing hierarchy is a two-way process. Researchers who do large-scale studies need to come to terms with the fact that it is logistically impossible for them to reach and include marginalized, vulnerable groups in their studies, which is one of my points here. There is a persistent problem of underrepresentation and undercount of marginalized groups in large-scale or randomized control studies, including in census and studies wanting to measure inequities. So they need to reach out and consider community gray evidence more seriously, not just in namesake. Community level investigations, including needs assessments and program evaluation, need to pay closer attention to methodological rigor. So we have our piece of work to do on the community side as well. You know, he says, at least write down their methodology in their report, who they talked to, why them, what they asked, etc. So, you know, the absence of the most vulnerable people from study cohorts is very, very problematic, and we consistently flag this. So you're right. I mean, we get called so often from partners wanting to do studies, and our first question is, are you talking to anybody who doesn't speak English? Are you going to be giving snacks at your focus groups? Will you be giving TTC tokens? Like, how do you expect, you know, and that's very basic, and, you know, aren't even really the most impactful access strategies. However, I do want to say, because it's important for me at this stage in my career to acknowledge that there's been massive change, and there is lots of hopeful things going on in health in terms of, yes, the social determinants of health actually do have something to do with health. So I love this infographic by the Canadian Medical Association, where they clearly are, you know, acknowledging what certainly all of us working in community have always known, that if you're not talking about social determinants of health, then don't bother. So this is very positive, and you know, as I said, we have had very positive experience for the most part with researchers. This is some of our, from academic researchers. This is some of our learning. So our approach is community-based participatory action research. We work in communities that have experience, that we have experience with. So we don't go into communities where we're not already working in a service delivery capacity or in a community engagement capacity. We recruit, train, and pay peer researchers to participate in all our projects. This includes development of questions, data collection, coding, and identifying emerging themes, co-writing, and development of dissemination vehicles, and participation in knowledge translation. It's extraordinarily messy. I think somebody already said messy. Takes a long time. It's very, very expensive, although we managed to do it on a shoestring because we're totally underfunded and unfunded to do this kind of work, especially the participatory action base, a piece of it. Perfect evidence is not a reality for us. We identify themes and we start moving forward with the transformative aspect of using this knowledge, because we are living in these communities and we see the compelling need for change, and we are working with communities, and it's transformative for them too, so they also want to move. You can't control that, nor would we expect to. It's interesting because this process, you talked about data. We have had challenges around ownership of data, understanding around ownership of data. In particular, we've had experiences where our academic partners have not wanted our peer researchers who are in the field doing the research to even talk about their experiences as peer researchers, let alone findings, because they viewed that as evidence that they in fact owned and would be controlling the dissemination of these findings. And it wasn't, you know, it's happened more than once, so it is an issue, and we have had conversations with many partners about this. And this is impossible. I mean, it's completely disempowering to not. I mean, it's transformative for peer researchers to do this work in their communities, to be part of thinking about issues and ways forward, and not then support them to be part of that way forward and talking about this. Especially as that is our expectation, that that's a critical piece of the research. So this is just a little, you know, we use that one. You know, we strive to ground our model in anti-oppression principles. It's transformative from the beginning. It was hugely transformative for us as an organization, let alone, you know, anything else. So we strive to ground our model in anti-oppression principles and practices, and it is very, very messy. Even our research coordinators get confused sometimes as to what their role is, and we've had to have long conversations in the community. You know, are they community workers? Are they advocates for community issues? Are they responsible for data quality and research rigor? It is a complex. But at the center, are the communities and the individuals that we work with. So, so I'm going to talk a little bit about the participatory system change piece of the equation now. Does research evidence really matter? Yes, but not so much. I mean, when you start trying to do systems change work, it's another world altogether, and there are so many other factors. And we truly do believe that research only matters if it is actionable, but it is easier said than done. So, we complain about community-based the research piece not being well funded. Well, nobody funds the participatory action, so we're very skilled at burying and disguising participatory-based advocacy systems change work into, a weekly drop-in free lunch for community members, or a community meetings with stakeholders. So that's a constant sort of challenge. The environment in the public policy space is not really receptive to receiving input. I mean, better now than it was just a few months and weeks ago at all levels of government. But still, it's not, and there's a huge timing disconnect. I've talked with people I know who work in policy roles in government who say, by the time we put something out there as a policy issue we want to discuss and get input, we're actually down that road. We've actually started making decisions and mapping pathways. So it's like, how and where do you insert yourself? It's a huge disconnect. And that's why it's critical to partner with advocacy agencies that are ramped up all the time. They might not be research agencies, but they're advocacy agencies. So, I mean, in terms of partners, this is a Yogendra slide. This was a model developed in Thailand that's used for health change policy around the world. And it is highly relevant. That's why I'm sharing it with you today. You have to generate relevant research knowledge in conjunction with the social movement or social learning, which includes public knowledge and attitudes. And you have to ensure that you have to ensure engagement of political decision makers, including lawmakers and the legal system. So it's moving forward on 3 fronts, and they have to be integrated and interconnected. So you already have to be thinking about this as you're just even starting research. So I just want to talk about a couple of case examples really briefly. So a key focus for us has been the impact on health of vulnerable people of precarious employment. We started this work well over 10 years ago, and we're not the only ones. I mean, there's some other reports here. It's, I would say precarious employment seems to be a defining characteristic of the changing world of work and the reality of this generation. Interestingly, when we started doing community development work in the high-need neighborhood years before starting to work on our Working Rough, Living Poor project, which was a multi-year undertaking that actually there were many sort of different products. We thought we were going in to talk about poverty. We started doing focus groups and talking about poverty and the impact of poverty. And it was community members and youth in particular who said, it's not poverty, we don't want to talk about poverty, we want to talk about employment. And the way that our parents are working, that is impacting our lives, and running around from all of these different jobs, and they're never home, but we never have money, and it's so unstable, and it's horrible. And they started talking about the impact of that in their communities and their lives. And I mean, it was, that put us on a path in terms of working with the community. One of the outcomes of this research, so I mean, we did the Working Rough, Living Poor, then we did Where Are the Good Jobs, which is 10 case studies coming out of that report, and then we were part of the Cura with our Like Wonder Women and Goddesses and Robots, which was again a more focused case study looking at the impact on immigrant women of precarious employment. So we launched, with so much of this evidence and other evidence, we launched our call to action on good jobs. And we've tried to identify what are steps towards good jobs, and have identified this broadly. We've established a community works group that undertakes actions based on our knowledge of issues, and we've done a lot of educational work with health promoters in the healthcare system to work with them around how do they use this evidence in a more direct way. And we feel these strategies are very actionable. We've got 5, take them home, think about it, what can you do in your organization? There's a lot of initiatives here, the whole Decent Work initiative too, and I mean, we ourselves are complicit in the whole issue of bad jobs. We need to start at home. And it's interesting, Access Alliance, our board of directors, we committed to $14 minimum pay for all of our roles last year when we were working on the minimum wage campaign. So, and I get calls from colleagues saying, what are you doing? My staff are flipping me this poster. They're giving me a hard time. I'm like, okay, different. Do something about it. What can I? So, I mean, we've done photo voice projects, video, op-ed pieces. Knowledge translation is a key piece. Just talking about gray literature, we did a community health assessment report for one of our sites where we take a look at what data do we have, but also what data exists out there through other reports. We pulled it together, and this was working with a community group that led the review of data and the prioritization. We use matrices. What does community think is most serious and most impactful, and then we take that directly into our program planning, and we link all of these items with initiatives that either we're trying to lead or leading with community groups, or we bring this to community tables. So just to wrap up, this is the action piece. We do have to move forward. As I said, there is positive change. We have so many stakeholders in health that are really stepping up, Canadian Doctors for Refugee Health, for example, and really doing amazing work, which helps our systems change. So some of our learnings is we have to use evidence as a strategic catalyst. It is all about strategy. If you don't have strategy, there's no point. The partnership piece and a movement is critical, and there are so many important partners that are ready and willing. Mobilizing champions, you talked about that. That is critical. Not only sector champions, but champions in community. Old school street rallies still are very important. I lost so much patience I went to so many rallies, but there's been like a resurgence of rallies in the last while, and they get attention. Ride that hyper-information highway and rock it. You got a blog post, you got a tweet, you got a Facebook. We have to use what tools are available to us. Money really does matter, not just from a funding perspective, but there is such interest in this return on investment, again, which I hated. But the whole kind of return on investment argument is a compelling argument, especially in terms of some of the tables where we're trying to do this systems change, where creativity, juice it up. I always remember Dina Ladd when she was doing the $14 an hour wage campaign. She talked about, it's been, the minimum wage has been frozen at $11 for how many years? And she would bring $11 frozen into a block of ice to meetings, which I thought was like, wow. And she does things like that all the time, very creative, like really making a visual, visible point. And be solutions driven. You have to be able to talk about the exact solutions that community wants to see and that you're driving towards, and be the change you want to see, and be passionate. Be the change you want to see. I mean, I'm fortunate every day I get up and have an opportunity to go to work and try to be that change. Thank you very much. I think I did okay on time too. Yeah, we're all doing good, eh?
Yeah, you did great. And we'll open it up to a couple questions. Thank you.
Okay.
I love Juice It Up. We're gonna take a few minutes now for questions, but there were so many things I think you packed into there and cracked open. I just want to flag a few that I hope we'll kind of come back to either now or later. I think there was this discussion point about undoing the hierarchical view, qualitative versus quantitative data. I assume that really resonates with people in the room. So let's make sure that comes out in the discussion or in the groups. This knowledge translation question about only valuable if it's shared and used, I think there's a lot of richness in a conversation about that and where it's happening, what's stopping some of this rich data from being used, the underfunding of community organizations to actually do this work. The money really, really, really matters. And then these various dimensions of messiness that you talked about, to use your term, around the ownership of the data, the researcher versus advocate tension. There were a number of different dimensions, I think, that we could call just some of the complexity and messiness of this kind of work and this kind of work together. So thank you for cracking so many things open that I hope we can revisit. But for let's take a couple of minutes to just take any questions top of mind that people have. Where is the mic?
I got it here.
Okay, perfect. Okay, great.
So, a big fan of your work, and I was wondering, do you have any peers? Like, has anyone followed in your footsteps when you created the first research department within a CHC? I'm not sure that many others have followed that, and that must have been brave and resourceful to start that and to build that with the same funding that everybody else gets. Are you mentoring any others who are following in your footsteps?
Well, that's a good question. There a few years, and everything has ups and downs. A few years ago, there was a community-based research network that was pulling together a lot of people that were engaged and they were meeting, but they lost some steam, and I think it's mostly, and we were very active for a period of time in driving that. There are community health centers and other organizations that do research, but sometimes it's more one-off or it's a piece of work. And, or for example, there's a sister community health center that they do research, but they work with researchers who come in, and so they still drive a lot of it. So it's a challenge. We want to actually get back to that. We're looking at trying to create a sort of a research advisory table. And for sure, in this targets-driven world, sometimes we have to try to figure out how to put some, because those staff, the funding they're unit producing positions. That's what they're called, right? Unit producing positions? So we sometimes need to think about what are those units we're reporting on.
I think this note about it being kind of courageous and bold, I think is an important one. What did it actually take? What was the impetus for you just making that decision to have that in-house research capacity?
Well, I think it was because we were so focused on immigrant and refugees, and within health commitment to evidence-based, there just was no evidence, and we were being so offended constantly by these calls for, can you put us in touch with this community that, the combination of, and then we needed questions answered and there was no information.